If you or someone you know is considering testosterone replacement therapy but is afraid that it might be dangerous for the heart, you can finally breathe easy. We now have strong, high-quality evidence. Testosterone therapy is safe for men even with pre-existing cardiovascular disease, and not probably safe, but officially confirmed through the largest and most rigorous clinical trial ever conducted on this topic. Let me break it down for you, clearly, confidently, and with the full respect that science and your health deserve. This groundbreaking trial is called TRAVERSE, conducted in the United States under the guidance of the Food and Drug Administration. It was randomized, double-blind, placebo-controlled, and officially powered as a non-inferiority study for cardiovascular outcomes. A total of 5,246 men were enrolled. Their age ranged from 45 to 80 years. Average duration of testosterone treatment, 22 months. Average duration of follow-up, 33 months. Testosterone was administered in the form of a daily transdermal 1.62% gel with dose adjusted to maintain blood testosterone levels between 350 and 750 nanograms per deciliter. The goal? To determine if testosterone therapy increases the risk of heart attack, stroke, or death from cardiovascular causes. All men enrolled had confirmed hypogonadism, defined as two separate fasting testosterone levels below 300 nanograms per deciliter, and symptoms such as low libido, fatigue, depressed mood, or reduced spontaneous erections. They also either had already experienced a cardiovascular event, heart attack, stroke, or diagnosed coronary artery disease, or had multiple risk factors such as high blood pressure, diabetes, elevated cholesterol, chronic kidney disease, smoking, or older age. In other words, this was a high-risk population, precisely the group in which testosterone therapy was most controversial. After nearly 3 years of observation, the results were clear. Major cardiovascular events, heart attack, stroke, or cardiovascular death, occurred in 182 men, or 7.0%, in the testosterone group, 190 men, or 7.3%, in the placebo group. The difference was not statistically significant. In other words, testosterone did not increase cardiovascular risk. This was confirmed across all sensitivity analyses and met the predefined criteria for non-inferiority. Even secondary events, including procedures like stenting or bypass, occurred at similar rates in both groups. It means we now have the strongest evidence to date that testosterone therapy, when properly indicated and monitored, is not dangerous for the heart. Testosterone can be used safely in men with low testosterone and existing cardiovascular disease. It can be part of a comprehensive plan to improve energy, mood, sexual health, and quality of life. But it must be done correctly. Confirmed hypogonadism, medical supervision, regular follow-up, hematocrit, prostate-specific antigen, PSA, and blood pressure. This is not a supplement. This is prescription hormonal therapy, and it should be respected as such. If you are tired, losing muscle, feeling down, and your testosterone is low, you no longer have to live in fear of treating it. The idea that testosterone causes heart attacks has finally been proven wrong in the most scientifically valid way. You can now discuss therapy with your doctor confidently, with science on your side. What does this mean for practice? The fear of testosterone-tolerant heart attack is unfounded if everything is done correctly. We no longer act by feel. Now we have science and we can confidently help men with hypogonadism live a full life without fear for their hearts.